Hey everyone, and welcome to the Chapter 6 lecture for medical terminology. This chapter is all about hematology, the study of the blood, and immunology, the study of the immune systems. Now, the body system that houses the blood is the cardiovascular system, which we talked about in a previous chapter. The blood components are technically a separate system. The cardiovascular system is the the organ that pumps the blood and the vessels that carry the blood throughout the body. But the blood itself has lots of components, and that's a separate field. So that's hematology. This is my cat, Athena. She says, hi. Immunology, the study of the immune system. The body system that houses the immune system. Come on, sweetie. Is the lymphatics, which is pictured on this slide. You're stuck on my shirt. Oh my goodness gracious. Cat butt. This is what recording videos is like. Okay. So the immune system is housed here in the lymphatic system. And there's a lot of vessels, these green vessels here. And there's several different organs that are part of the immune system or the lymphatic system. So I've got two words of the day for you. The first one is methemoglobinemia. And it's a mouthful, but we have this protein in our blood cells called hemoglobin, which binds to oxygen, but it can also bind to other gases. So you need to have a certain percent of your hemoglobin oxygenated in order to get oxygen sufficiently to your tissues. And if you don't, then you get hypoxia and your tissues don't get enough oxygen, and that's a problem. So if you have a lot of this methemoglobin, like more than 20% of your hemoglobin is methemoglobin, then you do start to have issues. You can start to have seizures, not getting enough oxygen to the brain. But there's a rare genetic condition, methemoglobinemia, where people have this sort of middle amount, 10 to 20% of their hemoglobin is methemoglobin. And it results in sort of a chronic cyanosis, so a chronic bluing of the skin. But there's no other health symptoms. So people with this can live till they're like 90, have no problems, but they just are blue, like human smurfs. So this picture here is a picture of the Fugates, the blue Fugates as they were known. It was a family in Kentucky. Several of them had this condition. And they were very healthy, they lived for a long time. But they definitely were alarming to some of the doctors they saw. The disease still exists. It's very rare because it's a recessive disorder. So you find it in small communities that do a lot of interbreeding. So these rural communities back in the 1800s, but now that's less common. Also, there is treatment for it now. So if somebody were to be born with it, they would just take the treatment and they wouldn't be blue. The other term of the day is anterior cervical lymphadenitis. So anterior means front, cervical means neck, and lymphadenitis is inflammation or infection of a lymph node. And this is a picture of my daughter when she was 3. She ended up with a staph infection in her anterior cervical lymph node. And you can see it here. It's very swollen and red and angry. And she took antibiotics, but it didn't help because it was too abscessed. It was really a thick infection. God, my cat's really going to be featured in this video. So she had to have it surgically lanced, where they cut it. And that's called an incision and drainage. We'll talk about that more in Chapter 7, Dermatology. So she had an IND, incision and drainage, and she had to have IV antibiotics for a couple of days in the hospital. So this is her after the surgery with her popsicle. So not all of that red is blood. Some of it is popsicle. All right, so some anatomy and physiology of the blood. We've got red blood cells, white blood cells, and plasma are the main components of the blood. So if you take somebody's blood in a tube and you either let it sit for a while or you spin it down in a centrifuge, it will separate out into these three parts. So the red cells are about a third to maybe at most a half of the blood, but it's about a third of the blood is made up of the blood volume is red blood cells. A majority of your blood volume is actually plasma. So plasma is this straw-colored fluid here. It's basically just water with a bunch of stuff dissolved in it. So these are all of your nutrients, all of your wastes, antibodies, hormones, all of those things are going to be found in the plasma, floating around in the plasma. And then this very thin layer here in between that you can see are white blood cells and platelets. So they're a very small percentage of the blood, but they have a very important role. And that little band will go up and if you have certain conditions that increase white blood cells. So white blood cells are actually part of the immune system. The immune system and the blood kind of overlap. The lymphatics and the blood, you'll see where they overlap. So some of the white blood cells from the lymphatics do enter the blood and help patrol the blood. The lymphatic system consists of lymphatic vessels, those green vessels we saw on the previous page, and there is fluid that flows through it. We call that the lymph or the lymph fluid. And there's all these different like little bulbous structures along the way that are called the lymph nodes. We also have lymphoid tissues, which are sort of patches of tissue within other organs that have immune function. And then we do have a couple of organs that really are primarily part of the lymph system. So they're lymphoid organs. Now the lymphatic system has a pathway through the body that's separate from the cardiovascular system, but does actually feed into the cardiovascular system. And it's not circular like the cardiovascular system circulates. It drains in one direction. The whole purpose of the lymphatic system is to house our immune cells, and our immune cells are our body's security system. They detect and destroy invading microorganisms that cause disease, which we call pathogens, which literally means disease agents. And also, a lesser known role of the immune system is it actually patrols and kills cancer cells. So when somebody gets cancer, it was actually due to a failure of the immune system to detect and kill it. So our blood cells, all of our blood cells, I'm going to move myself here. There, that's a nice spot. All right, they all come from our bone marrow, from stem cells found in our bone marrow. These are called hematopoietic stem cells. The process of forming blood is called hematopoiesis. So hematopoiesis takes place in your bone marrow from these stem cells that go through all these different stages of growth and development, if you will, ultimately leading to our erythrocytes, our red blood cells, our platelets, and then all of the white blood cells. So you don't need to know this order of development, but you should know the definition of hematopoiesis. You should know what a stem cell is. Stem cell is something that can turn into, it can basically grow and differentiate into different types of cells. And that the stem cells for blood are found in the bone marrow. So our red blood cells are called, the medical term for them is erythrocyte. Erythro means red, and cyte means cell. So literally it means red cell. We call them red blood cells. Another thing that you'll see a lot is the abbreviation RBC for red blood cells. So red blood cells are pretty unique in the body. They're the only cells in the body that don't have a nucleus. So they have a nucleus initially when they're going through that development process in hematopoiesis, but then they ultimately lose it. So if we watch the development here, the nucleus actually dies off. And so I think of red blood cells as kind of like drones. They're like pilotless airplanes flying around. Because they have no nucleus, they don't have the ability to keep generating new proteins, so they have a limited lifespan. They can only live for a few weeks, and then they die and you make more. So you're constantly generating new red blood cells, which is why you can donate blood, because your body's constantly generating new blood anyway. The main component of red blood cells, or erythrocytes, is hemoglobin, and hemoglobin is a red iron-containing protein that transports oxygen through the body. And it's one of the things that stimulates red blood cell production is a hormone called erythropoietin. Poiesis is formation, so poietin, that suffix "in" is kind of like a substance. So it's a substance that stimulates red blood cell production, and it's produced by the kidneys, actually. The kidneys can sense your blood pressure and your sort of hydration status, and so the kidneys are actually a major controller of red blood cell production. So when it comes to erythrocyte development, you don't need to know these stages, but I do want you to recognize some patterns in medical terms here. So as we go through the development, and you'll see this with other developmental pathways too, there's an erythroblast, then a normoblast, then a reticulocyte, and then finally the mature cell is the erythrocyte. All right, that suffix "cyte" means cell, and we typically use it as for a mature cell. Blast in biology refers to an immature stage or an immature cell. So I could ask a question that says something like, which comes first in development of the erythrocyte, the normoblast or the reticulocyte? And you don't have to have this pathway memorized to know that the answer is that the normoblast comes first because it ends in blast, therefore it is immature, and the cyte is more mature. So, little pro tip for you. Leukocytes. Leukocytes are white cells. Leuko means white. So our leukocytes, our white cells, are our immune cells. And we call them white blood cells or WBCs sometimes. They can be classified, there's a lot of them, so they're classified in different ways. The two, sort of the main groups, or the biggest way that we can, the simplest way we can classify them is either as granulocytes or agranulocytes. So granules are like little sprinkles or pockets of material within the cytoplasm of these cells that you can see. They're visible under a microscope. So white blood cells, leukocytes that have granules in them, are called granulocytes, and the ones without granules are agranulocytes, meaning without granules. So the three types of each are listed here, but I'm going to show you what they are and tell you a little bit about what they do. So let's first talk about the granulocytes. So the granulocytes, there's three types. There's neutrophils, eosinophils, and basophils. And you can see all these little granules in their cytoplasm, and they appear different colors. So all of these are named actually by the dyes that they are attracted to. So basophils, the granules stain blue with a basic dye, and eosinophils, the granules stain red with a red dye called eosin. And the neutrophils, you can see their granules very faintly because their granules don't really pick up either of those dyes. So they're neutral. They are neutral to the dyes. So phil, the suffix phil means attraction to. So it's really, they're named after what dyes they're attracted to and how they look under a microscope. So a little bit about their function. So neutrophils. Neutrophils are like the first responders of the white blood cells. If you have a cut, all right, the first white blood cells to the scene are going to be neutrophils. They're going to pile in, they're going to release chemicals that make your skin hot and red and painful, and they're also going to phagocytose or eat bacteria at the scene. And then they promptly die. And so if you have an infection, or like if you have a cut that gets really pussy, the pus is actually a bunch of dead neutrophils. So it means your immune system's doing something, but it's working really hard. Eosinophils, and neutrophils are also, they're the most common white blood cell in your blood. So if you took a smear of your blood and put it on a microscope slide and you looked around for white blood cells, there would be very few. Like there'd be a ton of red blood cells and just a sprinkling of little white blood cells, but most of those white blood cells would be neutrophils. Eosinophils and basophils have more esoteric functions in things like allergies and parasite infections. So less like pathogen. Well, parasites are pathogens. The agranulocytes, the ones without granules, are the lymphocytes and the monocytes. So the monocytes are, they develop into something called macrophages, and they are very important for engulfing microbes, chewing them up. They kind of patrol all of your tissues. So they're kind of like the mall security guards or something that are just there on patrol, keeping an eye out for things. And then if there is a break-in of pathogens, they alert the rest of the immune system. The lymphocytes are very important. They're the smallest of the white blood cells, and they are the ones that are broken down into categories of B cells and T cells that we'll talk about. So I guess I kind of went overboard in my picture explanations, because here's my detailed explanations for each of these cell types. So starting with the granulocytes, and my mnemonic for granulocytes is that, so all of the granulocytes are named something with "phil" at the end: neutrophil, eosinophil, basophil. So my best friend in high school, she had a grandma named Grandma Phyllis, and she was just really funny, and she was a character. So I just remember Grandma Phyllis is granulocytes are the phils. Okay, so neutrophils, like I said, they will engulf bacteria. That's a process called phagocytosis, which literally means a process or condition of eating cells. That's what they do. They're also known as polymorphonuclear leukocytes because their nucleus has many lobes. Polymorpho. It's a many-shaped nucleus, so it's weird. It's not like just a sphere. It's like, I don't know, like a lava lamp looking kind of a thing. They are very short-lived. I think of them as sort of like kamikaze fighters. They go in, they release all their chemicals, and then they die on the scene, and then you get pus. The other two granulocytes, the eosinophils and the basophils, eosinophils are really important for allergies and also for parasitic infections. And basophils also play a role in allergies. They release histamine and heparin and lead to some of those allergic reactions. The lymphocytes, the first type, the small type of agranulocyte, these are the ones that mature either into B cells or T cells. There's actually a lot of different types of lymphocytes, but these are the two main classes. So the B cells are called B cells because they mature in the bone marrow. So B for bone marrow. And that's where all of the blood cells come from, so they just stay there and continue to mature in the bone marrow. And their job is to make antibodies. B cells make antibodies. I don't know if you like stress that B in bodies for B cells. T cells, they develop initially in the bone marrow, but then in order to mature, they have to travel to the thymus, which is a lymphoid organ that sits right above the heart. And so that's why they're called T cells, because they mature in the thymus. Whoops. So there's two types of T cells. Actually, there's more than that, but the two simplest types of T cells are helper T cells that are involved in activating B cells to make antibodies. They basically just are messenger cells that go around. They get activated by macrophages. So when those macrophages in the tissue do phagocytosis and they engulf bacteria, they go to those helper T cells and they say, you know, here's the pathogen, like get the immune system going because this is the pathogen. And the helper T cells go around and basically activate all the other cells. Cytotoxic T cells. Cytotoxic means toxic or poisonous to cells. So cytotoxic T cells, their job is to basically go around and poison cells that have been infected. So they're really important for viruses because viruses get into cells. Not all bacteria go into cells, but viruses do. And so it's sort of, you know, killing all the sick cells so that they don't spread the virus to other cells. Um, a lot of lymphocytes are short-lived. They just live during the infection and fight the infection. But the neat thing about lymphocytes is there are a subset of them that live essentially forever in your body, and we call them memory cells because they remember the pathogen that you had, whatever disease, illness, contagious disease or infection you had. And so if you get it again, they can react and respond right away without the need for helper T cells to go stimulate like without that whole game of telephone that's needed to make antibodies. The memory cells can snap right into gear and start making antibodies. And so you may not even get sick the second time around because your immune system has this memory for this pathogen and they respond right away. So that's kind of a cool thing about the immune system. The last cell type are the monocytes. Monocytes are also phagocytes, like neutrophils. They engulf, they eat like bacteria and cancerous cells, dead cells. They're kind of the cleaner uppers. When they're in the blood, we call them monocytes, but when they move into tissues, we call them macrophages because they are large cells that eat things, macrophages. And I like showing this video because it's an actual video footage of a macrophage in a petri dish. So here's the macrophage. These are all red blood cells, and there's some liquid in here. And this little thing here is a diplococcus, a bacteria. And you literally get to watch this macrophage chase down and eat this bacteria. So I usually use one that has music. This one's pretty quiet. But he's chasing that bacteria there. He caught it, he swallowed it, and in some versions of this film, he burps. The macrophage burps. All right, so I just think it's really cool that a lot of times I tend to anthropomorphize things. I think of, imagine cells as like little cartoony things but it literally functions exactly the way you would imagine in a cartoon in your head. All right, so some other types of cells in the blood. Your thrombocytes. Thrombocytes are the platelets. So platelets is sort of the more common term. Thrombocytes, the more official medical term. Thrombocytes is a little bit of a misnomer because thrombocytes means clotting cells, right? But your platelets are actually not cells. They're cell fragments. So this is a megakaryocyte, and it sheds its cytoplasm, and those shedded pieces are the platelets. So we call them thrombocytes, but they're really not cells. That is what it is. So a thrombo means clotting. So a thrombus is a blood clot, and a thrombocyte is a clotting cell fragment, really. And of course, these thrombocytes are important for clotting. So clotting happens when a bunch of these platelets get together, they aggregate and form clumps, and then they bind to red blood cells and they form these fibers, and you get coagulation or actual clotting of the blood. And the whole purpose of blood clotting is to stop bleeding. So if you have a cut, a laceration, then you don't want to keep bleeding continuously until you lose all your blood. You need to stop bleeding. So the process of blood clotting is adaptive to prevent you from bleeding out if you have an injury. But it can also be dangerous because if your blood clots too much or clots inappropriately, it can cause blockages in the blood vessels. So there's this constant balance in anatomy and physiology. These systems that are meant to help us, but if they go or sort of overboard or if they overperform or underperform, it can hurt you. So the process of stopping bleeding is called hemostasis. And that's the ultimate goal of blood clotting in the case of like a wound. But it's also used in like surgeries and stuff. Doctors will say, you know, I don't know exactly how they'd say it, but they're trying to make sure that they reach hemostasis before they close up a patient. They want to like cauterize all the vessels and get this stasis or stopping or, you know, staying the same of the blood. So there's a lot of different clotting factors, not just the platelets, but there's several different proteins that are important for the blood to clot. It's actually like a chain reaction that occurs. And if you're missing any one of these factors, then you end up having a clotting disorder where your blood doesn't clot. And so there's like hemophilia. There's different forms of hemophilia depending on which of these clotting factors you're missing. So you don't need to know the clotting factors for this class. But I would like you to, like if I said, you know, prothrombin is a protein involved in what process? I would expect you to be able to say that it's involved in clotting because it has that combining form thrombo in it. All right, so that's really the only one, thromboplastin. All right, so things that I want you to know that combining form thrombo. Another thing about blood, our red blood cells, is you probably have heard of blood types. Maybe you know your own blood type. So blood is typed based on these proteins on the surface of red blood cells called the ABO blood groups. So there's A, B, and O are different basically tags that can stick off of red blood cells. So if you're type A, it means you have these type A proteins sticking off your red blood cells. If you're type B, I'm type B, then you have these B antigens. We call these things sticking off antigens. So you have B antigens sticking off of your cells. And if you are AB, like you inherited A from your mom and B from your dad, then you have AB and you have both types of antigens on your blood cells, A and B antigens. Type O antigens are very small, they're truncated. And so what an antigen is, I should define this term antigen. An antigen is anything that your body recognizes and makes antibodies towards. So if you have type A blood, your body's not going to make antibodies towards the type A antigen because that's your self type. But it will make antibodies against foreign antigens, like type B. All right. So people with type A blood have antibodies against type B. So if they got type B blood, they would attack it. The O antigen is so small that your body doesn't actually, it's not actually an antigen. Your body doesn't recognize it and there's no antibodies made against type O blood. So that's why it's called ABO and not ABC, because that O antigen is really like a 0 because you have there are 0 antibodies against it. So if you have B blood, then you're going to make anti-A antibodies that would attack any A blood cells. If you have type AB blood, you have both antigens, so you wouldn't make either antibody. You make no antibodies. And because of this, AB blood is the universal acceptor. They can get blood from someone with A, someone with B, someone with AB, or somebody with type O blood. They don't have any antibodies that would attack foreign blood cells. Type O, because the blood cells are essentially naked and have no antigens, according to the immune system, type O blood is the universal donor. You can give it to anyone because none of these antibodies there's no antibodies that are anti-O to attack them. But people with type O blood make antibodies to both A and B, so you really can't give them any of these other blood types. They have to get type O. So people with type O blood are constantly getting calls from blood banks because their blood is the most valuable. It's the only type of blood you can give to people with type O blood, but you can also give it to anyone else. So yeah. The other blood group antigen is the Rh antigen. So you might have A or B positive. So my blood type is B positive. My dad's blood type is O positive. I think my husband is O negative, but he might be O positive. So that positive or negative after the ABO letter, that's referring to your RH group. So if you have, most people are positive. A majority of people have a positive blood type. The negative blood types are more rare. Alrighty. So now to talk about the anatomy of the lymphatic system. We've got lymph vessels in green here that contain lymph fluid, and the lymph fluid flows through. It really, a major purpose of the lymph system is actually to drain excess fluid from your body tissues. So it drains excess fluid in, sort of this direction. You'll also notice in some places these little circular bulbous areas. All right, those are called lymph nodes. And lymph nodes, I kind of think of the lymphatic vessels as like train tracks, and the lymph nodes as the train stations where the train stops and all the people get on and off. So in the lymph nodes, you get a lot of filtering of the lymph. If there's any pathogens in it, they will get picked out and exposed to like T helper cells and stuff in the lymph node. The lymphoid tissues, these are different, like just patches of tissue, so they're not whole organs. The lymphoid tissues are the tonsils and adenoids in your throat, and they are just sort of patches of tissue in the oral cavity and the pharynx that have extra white blood cells in them. And then in the intestines, you have these Peyer's patches, which are patches of tissue in the small intestine that have a high amount of white blood cells. So they're not lymph nodes and they're not lymph organs, they're just patches of tissue in areas that are really vulnerable to pathogen invasion, right? So when you breathe in air or you swallow food, all right, the pharynx is like the open, that's like what both air and food pass before going down into the stomach or going into the lungs. And so it makes sense that you have some sort of like extra security there, basically, some extra immune cells there to patrol that sort of entryway. And then the other one is the intestines. Your intestines are chock full of bacteria themselves, but also you're doing a lot of absorption from the intestines. And you're eating food from the outside, it goes into your body. So the intestines are also a potentially vulnerable site for invasion. So those are just basically, you can think of the lymphoid tissues as like extra security at these vulnerable locations in the body. The lymphoid organs, there's two organs that are really primarily part of the lymphatic system, and that is the thymus and the spleen. So the thymus is this sort of fatty looking organ that sits on top of the heart. And of course it's important for T cells, T for thymus, that's where they go to mature. And then there's the spleen. Now the spleen is almost like, well, it has a couple of functions. So one of the things it does is it actually filters out red blood cells. So it's important in hematology because we said your erythrocytes only live for a couple of weeks because they don't have a nucleus. They're basically like drones flying around. And when they get old after a couple of weeks or a few weeks, they start to get misshapen and start to fall apart, and the spleen basically grabs them and breaks them down. Your spleen also actually holds a store of extra blood. So like if you were hemorrhaging, your spleen could actually release that blood and basically give you some more blood to buy you some time until you reach hemostasis and stop bleeding. The spleen also functions as almost like a giant lymph node. There's a lot of white blood cells there. And so during that filtering of the blood, they're also, and that's what lymph nodes do, they filter the lymph. So those are the two lymphoid organs, the thymus and the spleen. So now for diseases and conditions of the blood and immune system, starting with the blood. So hemorrhage is a excessive flow of blood. So hemorrhage is basically bad bleeding, like a little cut. You wouldn't say you're hemorrhaging, but if you have a large laceration, then you might be actually bleeding profusely from that. That's a hemorrhage. You can also bleed internally and have a hemorrhage internally. Pancytopenia means a deficiency, enia, of all pan-cyto cells. So it's a deficiency of all red blood cells. And this can happen if you have a deficiency in your stem cells, the hematopoietic stem cells in the bone marrow. If they're not working properly, they're not able to differentiate, then you're going to not have enough of all the cells, because all the cells come from those stem cells. Then there's other types of conditions where you're missing certain types of blood cells. So anemia specifically is a deficiency of red blood cells. And there's many forms of anemia. Folate, there's different nutrients that are important for the formation of red blood cells, like folic acid and iron. And so if you are deficient in your diet of those two things, one or the other, you can end up with anemia. The red blood cells have a different sort of phenotype, a different appearance in each of these different types of anemia. Another nutrient that's really important is vitamin B12. So your B vitamins, folic acid is a type of B vitamin, and iron are really important for proper red blood cell formation. So make sure you're getting enough of those so you don't get anemia. Then there's also genetic forms of anemia, like sickle cell anemia, which is pictured here. So here's some normal red blood cells, and here's some sickled red blood cells. So they are elongated and curved, like a moon shape. And that's a problem because red blood cells, when we talked about the capillaries, we said the capillaries were so skinny that red blood cells could only move through like one at a time, single file. Well, look at how long these red blood cells are. They can't always fit through those capillaries, and sometimes they get stuck and they cause blockages, which is very painful for a person, and that's the danger of that disease, really. And also they don't transport oxygen well, so you're not getting enough oxygen, the ideal amount of oxygen, but more importantly, you have potential to block capillaries with those sickle cells. So I also just want to point out some of these words here. Macrocytic, folate deficiency causes macrocytic red blood cells. They're very large when you look at them under the microscope. Iron deficiency anemia causes very small microcytic red blood cells, and they are hypochromic. Chromo means color, and hypo means deficient, so they're very pale. They're small, pale red blood cells. So that's what's pictured here, someone with iron deficiency anemia. And before I leave this slide, I'll go back up here to septicemia. So septicemia literally means a condition of the blood that is septic. Septic meaning like a septic tank full of bacteria. So we also call this condition sepsis for short, or sometimes you'll hear people call it blood poisoning, right? All the same thing. And it's when you have bacteria actively replicating in the blood, and it's a very dangerous condition, and the patient can deteriorate very rapidly. It's very critical to get timely treatment for someone with sepsis. So some conditions, more conditions of the erythrocytes. Besides anemia, you can have anisocytosis, which is a condition where the red blood cells have unequal sizes. Poikilocytosis is a condition of irregular cell shape. So poikilo means like a regular shape. A transfusion reaction. So this one's really important. We talked about the different blood types. If you give someone the wrong blood type, they can have what's called a transfusion reaction, where basically their antibodies and attack the incoming transfusion cells and cause a lot of havoc. And so they ultimately kill those red blood cells, those donor red blood cells, and that's called hemolysis. Which lysis is destruction of the blood. So hemolysis is destruction of those donor red blood cells by their antibodies and immune system. Some conditions of the white blood cells, the leukocytes. HIV, human immunodeficiency virus, is a virus that is cleverly evolved to attack white blood cells. And it's clever because no, it's not like a Trojan horse. But it's attacking the immune system. The immune system is there to kill pathogens. But if the pathogens kill the immune system first, then they win. And so that's what HIV does, and it leads to a condition called acquired immunodeficiency syndrome, or AIDS, where it just leaves people completely vulnerable to all kinds of infections because it basically destroys their immune system. And so we say that they are immunocompromised. Their immune system is compromised, and when their immune system is compromised, they can get infections from bacteria and fungi and viruses that don't normally make people sick, but it makes them very sick and can actually kill them. So we call those opportunistic infections. They're pathogens that take advantage of the reduced immune system, that immunocompromised state, in order to cause an infection. So they're opportunists. Leukemia, it literally just means a condition of white blood, a condition of the blood that is white. And that is because it's really what it is it's cancer of the white blood cells. So cancer is an overproduction of cells. It's an uncontrollable copying and division of cells in a tissue. And so in most tissues are solid, so having extra cell production results in a tumor. But with white blood cells, they're in a fluid, and so when you get an overproduction of them, then you just get a bunch of white blood cells in the fluid. So it's a non-solid, it's not solid cancer. And so before cancer was even really known or understood or named, a doctor was seeing patients, and one of his patients came in, and she said she was just really tired and she had all this joint pain, and he took her blood and it was milky. He said it was like almost like a milky substance because there were so many white blood cells in it. So he called this condition leukemia, and it was only later that doctors realized it was a form of cancer. But somebody with leukemia would have a lot of extra white blood cells, sometimes so much so that you could actually see it when you draw their blood, that it's kind of milky. Mononucleosis is an infection by a virus called Epstein-Barr virus, and it also can infect white blood cells and can make you feel really, really sick. It's usually just referred to as mono. The disease is called mono, but the full disease is called mononucleosis. And it can really do a number to the spleen and some other organs, depending on when you get infected with it. So, thrombocytes, diseases, conditions of blood clotting. So you can have a condition of excessive blood clotting or deficient blood clotting. So any type of blood clotting disorder is called a coagulopathy, a disease of clotting, right? Some common ones, a DVT, a deep venous thrombosis. This can happen when your blood clots, particularly in your legs. If you have been like immobile or bedridden for a while, it can happen they warn you about it on like very long plane rides, like 20-hour plane rides, to get up and walk around. Don't just sit still the whole time, because what can happen is blood can pool in the veins of your legs. Remember, veins rely on your muscle movements to pump blood. So if you're sitting still or you're laying in bed and you're not moving your legs for several days, then these clots can form, and then they can get loose, and then they can travel to other parts of the body where they cause blockages, or they can cause a blockage in the leg itself. So a sign of a DVT is redness, swelling, pain in your lower leg, your calf. That can be a sign that you're developing one, and you need to get to a doctor right away because they need to break up that clot before it dislodges and ends up somewhere else, like causing a pulmonary embolism or a heart attack or a stroke. Hemophilia is a condition where you you're missing certain clotting factors and your blood doesn't clot. So remember, there were 9 different clotting factors, so any one of those missing would result in hemophilia. It literally means a condition of being attracted to or loving blood. And that's because in the early days when people didn't really know what this disease was, but they knew that their blood was very, like people who had this condition, their blood was very thin. It didn't clot, so if they were bleeding, they just kept bleeding. And so they needed blood transfusions. And they would basically always be anemic. And so they needed these blood transfusions. So they were hemophiliacs because they needed blood transfusions, essentially. It's kind of like where the name came from. Thrombocytopenia is a deficiency of thrombocytes, clotting cells, platelets. So if you're missing platelets, thrombocytopenia and hemophilia are sort of similar, but also different in their presentation. But in both cases, those would be coagulopathies where the blood does not clot enough. Some other things in the lymphatic system. Lymphadenopathy, it means disease of the lymph glands. Really what it is it's enlarged lymph nodes. So like when you're sick, like you have a sore throat, maybe your mom or your doctor or someone will feel your lymph nodes to see if they're swollen, your cervical, anterior cervical lymph nodes. And if they are, that means you probably have some kind of an infection and your immune system is turned on and it's working and fighting it. So your other lymph nodes in the body can be swollen too if you have an infection somewhere else. It's a sign of infection. Lymphedema is the swelling of a limb that occurs after you remove lymph nodes. This happens a lot in people with breast cancer. When the breast tissue and the lymph nodes are all removed, you get swelling because there's less drainage. So it's edema from poor drainage of that limb. A lymphoma is a tumor of the lymph nodes, basically a lymphoid tumor. Splenomegaly is enlargement of the spleen. Notice that this combining form spleno, that's not a typo, it is splenomegaly, not splenomegaly. And a thymoma would be a tumor of the thyroid. There are several disorders of the immune system where the immune system is overly active and it starts attacking your own tissues. It recognizes your own tissues if they are foreign invaders and starts attacking them. And these types of disorders are not terribly well understood. It's understood what's going wrong, but a lot of the times researchers and doctors still don't really know what causes these conditions, so we don't have cures for any of them. We have treatments to try to keep them under control, but we don't know how they start, so we don't know how to prevent them. One type is diabetes mellitus type 1. So the diabetes that's triggered by diet and lifestyle, that's diabetes type 2. But diabetes type 1 is an autoimmune disorder where your immune system attacks the pancreas, the insulin-producing cells of the pancreas, and you stop producing insulin. Inflammatory bowel diseases like Crohn's disease and ulcerative colitis that we talked about in Chapter 5 are both autoimmune conditions, which, by the way, autoimmune literally means self-immune. Your immune system is attacking yourself. Psoriasis is an autoimmune condition of the skin. Multiple sclerosis is an autoimmune condition of the nervous system, where the myelin or fatty sheaths that protect your neurons get attacked. Rheumatoid arthritis is a joint disease. Arthro is joint, so it's inflammation of the joints due to autoimmune stuff. So there's a whole bunch of different autoimmune disorders. Sometimes we talk about them in the chapter about that body system, like we did with inflammatory bowel disease. But technically, Crohn's disease is an autoimmune disorder, but its damage is done in the gastrointestinal system, so that's why we talked about it there. So these autoimmune disorders can affect all different types of body systems. Some laboratory and diagnostic procedures that can be done in the world of hematology and immunology. A very common one that's done for people who need a blood transfusion would be a type and cross match. So they look at your ABO antigens and your RH groups, and they tell you, type your blood. What type of blood do you have? B positive, A negative, so that they know what type of blood to give you if you needed it. A complete blood count is a very standard blood test that's done on people. It gives you a lot of information. Basically, they're counting all the different types of cells in the blood. So they're counting your white blood cells total and also the different types of white blood cells, so like neutrophils, maybe your lymphocytes, your red blood cell counts, hemoglobin. So there's a whole bunch of different they're looking at all those different, the lymphocytes, the neutrophils, the monocytes, the eosinophils and basophils. So they're counting all those different types of cells. And it can tell a lot. So you can look for things like anemia, if the red blood cells are low, or infection, if the white blood cells are high, and leukemia, if the white blood cells are high, and even some of these specific subsets of white blood cells can give you more of a clearer picture of what type of leukemia or what type of infection someone might have. So that's what a complete blood count, a CBC. You hear that ordered a lot. The doctor's ordering a CBC. It stands for complete blood count. Some medical procedures that are done: phlebotomy. Phlebo means vein, and tomy means to puncture, or means an incision. It's not really an incision, it's more of a puncture, but phlebotomy is the process of taking blood from someone. It's also called venipuncture. Vaccination, also called immunization, is giving someone a vaccine. So vaccines are basically either pieces of a pathogen or dead pathogens injected, usually intramuscularly, but sometimes other types of injections. And basically, they are like harmless, tamed pathogens that are injected in your body to expose your immune system and let them. It's kind of like a I don't know, like training for your immune system. It's like, okay, guys, this is what would you do if you saw this pathogen? And your immune system makes all of the different cells, and it makes the memory cells so that you end up with this immune memory. So if you ever do actually come into contact with that pathogen, your immune system already remembers it and can fight it off faster. Blood transfusions are when you need extra blood because you've lost a lot of blood. There is something called an autologous blood transfusion. So sometimes, like a couple of weeks before a planned surgery, they might take some blood from a patient and keep it on in order to give it back to them if they need it during surgery. But a more common form of autologous blood transfusion is using different tools is not the right word, but they do have systems where they can actually capture blood that's lost from the patient and then stick it back into them during surgery. A bone marrow transplant can be useful for someone with diseased bone marrow. So their stem cells, their hematopoietic stem cells aren't working properly. Even sometimes it can be used for a treatment for leukemia. So a bone marrow transplant is usually from another person, and we call that an allogenic bone marrow transplant. Some surgical procedures, some ectomies. If your spleen is removed, it's called a splenectomy. If your thymus is removed, it's called a thymectomy. If you have tissue that, like if you have a swollen lymph node, they might want to do a biopsy of it. They might want to take a little bit out and see, is it cancerous? And then lastly, drug categories. So we've got anticoagulants and thrombolytics, which both are helping to control blood clotting. So an anticoagulant prevents clots from forming, and a thrombolytic breaks up clots. So they have different functions. And if you take them both, you have to be really careful. And doctors will monitor you really carefully because they want to make sure that your blood still clots, but doesn't clot too much. So someone with a DVT, for example, a deep vein thrombosis, would be put on on thrombolytics because we want to break up those clots. But somebody who's prone to a lot of clotting or has a clotting disorder would be put on an anticoagulant to prevent their blood from clotting. Corticosteroids are an important class of anti-inflammatories. So when you have a lot of inflammation from the immune system, it leads to a lot of pain. You might be given a steroid. Erythropoietin is a natural chemical that's made by the kidneys to increase red blood cell production, but we also have synthetic forms of it. It's often referred to as EPO. It's illegal in like the sports arena. It's a doping drug because it increases your red blood cells, and increasing your red blood cells increases your oxygen to your tissues, which can increase muscle performance, and so it's illegal to use in the world of athletics. But in somebody who's very anemic or somebody, I don't actually know all the medical conditions in which a doctor would use it, but they can actually use it to stimulate red blood cell production. Immunosuppressants sounds kind of counterintuitive. Why would you want to suppress the immune system? Why would you want to make it, like turn it down when the immune system is good for you and fights off pathogens? Well, remember, there's a lot of people who have autoimmune diseases where their immune systems are like a little too active, a little too happy-go-lucky and attack too many things. And so people with autoimmune disorders are often on immunosuppressants. Also, people who get organ transplants also will be put on immunosuppressants, because if they're getting an organ transplanted from a different person, that's a foreign organ, and so there's always the chance that the body will recognize it as foreign. The immune system will attack it, and so you want to kind of suppress the immune system so it doesn't try to attack that new organ. And then lastly, the antiretroviral medications that have made huge progress in the last 40 years are to treat HIV. HIV is a retrovirus, and it is largely controlled through medication now. So when HIV first hit the United States in the 1980s, it was basically a death sentence. Everyone who had HIV, like almost everyone who got HIV, developed AIDS and died. Now it's a much more survivable disease. You just have to be on medication forever to keep the viral loads down, but there's tons of antiretrovirals that are very effective. So that is the end of Chapter 6 lecture, and I will see you next time. Bye.